Good morning, everyone, or good afternoon, or good evening, depending on where you're dialing in from today. Welcome to our final session in our Beyond Our Walls webinar series, which explores the impact the Princess Margaret Cancer Center is having around the world through our global cancer program. My name is Mio Yamashita. I'm the new president and CEO of the Princess Margaret Cancer Foundation. I want to thank you for giving us your time today and for joining us. As one of the top 5 cancer centers in the world, the Princess Margaret has a number of international partnerships. In fact, you're going to hear directly today from leading clinicians from some of our international partners in Brazil, in Jordan, and in India. And we really believe at the Princess Margaret that these partnerships are critical to not only helping us, but helping the world advance innovation in cancer care, education, and research. Now, as an audience member, this is your time today, and we encourage you to ask any questions that you have and to share your feedback with us. And you can submit your questions throughout the session at any time using Slido, and the link can be found in the session description below. Now, before I introduce our panel, as well as some leading oncologists at the Princess Margaret, we've got a brief video message that we'd like to play for you from Dr. Craig Earle. Craig is the Vice President of Cancer Control, as well as the incoming President and CEO of the Canadian Partnership Against Cancer. Let's hear now from Craig, and we'll hear about his thoughts on the important role that global partnerships can play in cancer control.
I'm Dr. Craig Earle, Vice President and incoming CEO of the Canadian Partnership Against Cancer, CPAC. As steward of the Canadian Strategy for Cancer Control, CPAC's goal is to improve equitable access to quality cancer care in Canada. But we recognize that we can't do this in isolation. Connection to the international community is essential for a number of reasons. Canada, of course, has much to offer in terms of our expertise and resources, but we can also learn about innovative best practices for cancer care delivery from other systems, and about ways to address disparities here at home through seeing what's working in low and middle income countries. Many Canadian institutions and organizations are recognizing the importance of international collaboration to address shared challenges and are investing in partnerships in this area. CPAC was privileged to work with the Princess Margaret Global Cancer Program to co-host the first annual Canadian Global Oncology Workshop in November of 2020. This workshop brought together over 100 leading clinicians and academics active in global health. The number one recommendation coming out of the workshop was to create a Canadian Global Oncology Network, and we're delighted to see Princess Margaret's continued leadership in establishing this. The purpose of the network is to bring together Canadians who are working in global cancer control in order to foster collaboration and learnings. We believe that by working together on training, research, and advocacy, Canada can have a much greater coordinated and harmonized impact on fighting cancer around the world.
Well, I hope you enjoyed that message from Craig. As a wealthy nation, we think it's so important for Canada to play a leadership role around global cancer control. So thank you very much for taking the time to listen to Craig. It's now my pleasure to introduce some Cancer Center colleagues, Dr. Danielle Roden and Dr. Mary Gospodarowicz. If you joined our earlier sessions, you know Danielle and you probably know Mary. Dr. Danielle Roden is a radiation oncologist here at the Princess Margaret Cancer Center, and she's the director of our global cancer program. She's also the Director of Equity, Inclusion, and Professionalism for the Department of Radiation Oncology at the University of Toronto, and an elected member of the Board of Directors for the Union for International Cancer Control in Geneva. I also know that Danielle is the recipient of a Harkness Fellowship, which I've learned through my time at the foundation is the equivalent of the Rhodes Scholarship in cancer. Danielle's clinical interests are in breast cancer and hematologic malignancies, and she's also a health services researcher who studies questions related to cost, quality, equity, and access in cancer care. Many of you also know Mary Gospodarowicz. Mary's the past director of the Princess Margaret Cancer Centre. She received the Officer of the Order of Canada Award in 2015 for her contributions to cancer and radiotherapy. And she's also a senior advisor to the Global Cancer Program directed by Danielle. Later on in our webinar, we'll hear from our international guests, but I'm now going to have a quick discussion with Mary and Danielle before we get to our international panelists. Welcome, Mary and Danielle, to both of you. Danielle, for any of our audience members who weren't able to join our first webinar, I'm wondering if you could briefly share the vision of the Global Cancer Program at the Princess Margaret.
Thanks very much, Mio, and it's a real pleasure to be here with everyone this morning. Our Global Cancer Program is really about recognizing that cancer is a problem that affects people all over the world, and that being able to fight cancer requires us to work together. We can't solve a global challenge alone. Nearly 20 million people around the world were diagnosed with cancer last year, and if we want to be able to make progress in the way that we treat disease, we need to be able to harness the scientific expertise, knowledge, and patient experience from around the world. So the goal of our program is really to encourage, support, and promote this type of collaboration. And another important goal of our program is around promoting health equity. There are profound inequalities around the world and even in our own communities in access to cancer treatment. And the goal of our program is to help support initiatives to reduce those inequalities so that cancer patients everywhere can have the same hope for curing their disease.
Thank you so much, Danielle. That's an incredible vision. Mary, I'm wondering if you could talk a little bit more about your involvement in the Global Cancer Program and why is it so important to you personally and so important for the world?
Thank you, Mia. We collaborate a lot in research, and the research collaborations extend around the globe. And it took us a number of years to understand that if we all do our own research on our own, we can move the agenda forward, we can learn, we can create new knowledge. But if we partner, so for example, if we do clinical trial alone, it may take 5 to 10 years. If we partner across the world, we can finish it much faster. And I think this last year just showed us how fast you can move when you collaborate. The COVID vaccine trials have been done globally, and suddenly we had an effective vaccine within a year. So global collaboration is important. And on an individual basis, we've been doing it for decades. And in fact, my colleagues and my mentors at Princess Margaret collaborated globally 40, 50 years ago with UICC, creating standards for cancer staging, policies, but those were individual collaborations. What we've realized is that it is much more fruitful if you collaborate as an institution, as an organization. You can involve more people, you can connect, and you can learn on the larger scale. And learning and research and exchange produce new knowledge. And knowledge is probably the ultimate global public good. Once you create the knowledge, anybody in the world can use it. And it cannot prevent anybody else from using it. So if we can create new knowledge about cancer faster, we can advance cancer control faster. And that collaboration needs to extend beyond research, because we've realized that with the speed of research, there is a growing gap between what we know and what we do. So we also need to learn how to apply the new knowledge faster so the patients all over the world will benefit. And Toronto, as we know, is extremely multicultural, multilingual, multinational country. And if we collaborate with many countries around the world, we can learn more about different cultures, different way that patients can be approached, and ultimately our patients will benefit. And in fact, right now, any self-respecting comprehensive cancer center in the world has as part of their mandate global collaboration. So we are very fortunate that there are a number of institutions that wanted to collaborate with us. Actually, our first collaboration was with a cancer center in Italy. And it was actually spearheaded by our donors. The donor walked in and said, you know, I know such and such in Friuli in Italy, and you ought to collaborate. They have a very good cancer center. And sure enough, it was a very good cancer center. We've had very fruitful collaboration. So a number of collaborations sort of start organically with people partnering, but then they grow. And I'm very pleased that we will have on the panel some of the leaders of the large, extremely renowned comprehensive cancer centers who are collaborating with us right now.
Absolutely. And I love your idea of scale, that maybe a couple of decades ago, Mary, some of these collaborations were more informal. And now we're being much more deliberate about this as a global cancer community. And the idea that knowledge is the ultimate, global knowledge is the ultimate public good, public asset, I think is such a critical concept. Why don't we get to our international panelists now? And I'm very happy to introduce them. There's 4 of them. So I'm going to start with Pramesh. Pramesh is the head of thoracic surgery and the director at the Tata Memorial Center in Mumbai, India. He's also the coordination of the National Cancer Grid, which you'll hear more about today. And that's the largest network of major cancer centers in India. And it's committed to providing uniform standards of cancer care across the country. Jamal Khader is a radiation oncologist at the King Hussein Cancer Center in Amman, Jordan, and he's the head of the gastrointestinal and the genitourinary and thorax radiation oncology services. He's also the director of the International Affairs Office and the Radiation Oncology Residency Program. Dr. Victor Pinhana de Andrade is the medical director at the AC Camargo Cancer Center in São Paulo, Brazil. His focus is on surgical pathology. And in 2016, he assumed the leadership of the medical board of the institution, resulting in a consolidated cancer model. And finally, Dr. Mike Milosevic is a radiation oncologist at the Princess Margaret Cancer Center and a professor of radiation oncology at the University of Toronto. And his clinical practice focuses on gynecological cancers. Michael is committed to building radiation treatment capacity in developing parts of the world where gynecological cancers, unfortunately, are among the most common and devastating diseases. I want to welcome the 4 of you and turn it over to Danielle for some questions. Thank you again for joining us today. I know some of you are joining us late in the day.
Thanks very much, Mio. And it's a real pleasure to have everyone here today. I thought we could start by introducing everyone's cancer center. You know, I think we all know about your cancer centers, but some of our listeners today may be learning about it for the first time. And so I was wondering if each of you could talk a little bit about your institution and describe why this collaboration and international collaboration is important to your institution. Maybe Victor, if I can start with you.
Well, good morning, all of you. It's a great pleasure for me to be talking to you today on behalf of AC Camargo. AC Camargo is a private, not-for-profit cancer institution in São Paulo. São Paulo, it's 20 million people in our great area. And we are the biggest cancer center in Latin America for patient care, and we also lead education and research endeavors here in Latin America as well. We are 508 beds and fully prepared to treat any type of cancer with any complexity. We are a reference cancer institution for the whole country. We don't have a lot of cancer centers in Brazil, so most of the complex cases come to be treated here. And we are very honored to be a partner of Princess Margaret. In fact, a little piece of Princess Margaret lives here. We have our head of oncology, is Rachel Rickman, that was trained in Princess Margaret. So the Princess Margaret culture influences us every day. We have monthly meetings with Princess Margaret talking about patient safety, quality, efficiency, and research and education initiatives that speed up everything here in Brazil. We also take the opportunity to learn from Princess Margaret and help to spread the word about cancer control in the whole Portuguese-spoken community in the world, including African countries, that I believe will create equity faster than if we weren't working together. So it's a great pleasure for us to work together, and I believe we can also offer some learning for Princess Margaret from Brazil, as we have rare cancers here that may teach something to other places as well.
Absolutely. Thank you so much, Victor. Pramesh, can I turn it over to you next to tell us a little bit about Tata and why this collaboration is important?
Thank you, Daniel. It's a pleasure to be part of this meeting. Good morning to all of you. And just to give you a brief background about the Tata Memorial Center, we are, and I'm probably being repetitive here amongst all the panelists, we are the largest, the oldest, and de facto the national cancer centers of our respective countries. And with this power also comes great responsibility. And this is primarily where we feel that there is this huge scope for better global cancer control, primarily because of the collaborations that we make internationally. One of the major reasons that we embarked on an international global oncology program was the fact that we realized that we could learn from each other, and the sum of the parts is much more than what an individual cancer center could do by itself. And as Mary gave this a very elegant example of clinical trials and research being better if it is collaborative and multicentric, I think there's a lot more that we have at stake here. We have a lot to learn from each other as far as patient care is concerned, as far as education is concerned, and we've personally benefited immensely from these collaborations. So to me, the fundamental element of any collaboration, whether it be national, international, regional, is the fact that it needs to be a bilateral or a multilateral and an equal engagement. Very often we have these north-south collaborations which are fairly lopsided. And one of the most important aspects of our collaboration with the Princess Margaret has been that it has been on an equal footing. At no point where we felt, where we made to think that we were a low middle income country and Canada is a high income country. It was an equal collaboration at every point. And I think this is fundamental and core to the aspect of how collaborations work well. We have several examples of how high income countries have parachuted into low and low middle income countries and practically hijacked their cancer care and their research agenda. But what we need to understand and realize very clearly is that if there is not an equal and mutually beneficial collaboration, it's probably a waste of all of our times. And this is one reason why I feel the collaboration between the Tata Memorial Center and the Princess Margaret Cancer Center has been so hugely beneficial. And I would hope that it's mutually beneficial and not just for the Tata Memorial.
Thank you so much, Pramesh. And certainly we have learned as much from you, if not more. And I think you've really touched on an important point around this new paradigm of collaboration and global collaboration, which I think is really important for all of our cancer centers. Jamal, perhaps I can turn it over to you next. Maybe if you can unmute yourself, that would be great.
Yeah, thank you so much, Daniel. Well, I'll just give you a brief about the King Hussein Cancer Center, which is in Amman. It is the only comprehensive cancer center in Jordan and among a few in the region. Actually, we treat both the pediatrics and adult patients. It has evolved over the past several years to become the first choice of thousands of patients seeking premium holistic cancer treatment from actually across the Arab world. The center provides world cancer treatment and has received various international accreditation like the GCI, CAB, Magnet, which the last one actually was the Magnet, which is excellence in the nursing care. And also these accreditation serve as testaments to the high quality of treatment offered by the cancer center. We enjoy a strong partnership with world leaders in cancer care, including Princess Margaret Cancer Center, and we're really proud of this continuous successful collaboration between us and between the Princess Margaret Cancer Center, where it's really considered to be a model of fruitful collaboration. And indeed, we last year, we published an article, a joint article about how this collaboration is a model that others can follow. And as my colleagues just mentioned, it is win-to-win situation between the cancer centers collaboration. We work together at many levels, like the capacity building, mainly short and long training, and also the faculty exchange visits, holding monthly multidisciplinary case conferences where we discuss difficult and rare cases. Probably our colleagues in Canada, they don't see it frequently, and we learn from each other by reviewing literature, by meeting both teams from both institution, and also present some update in the treatment of such cases. Now, we started this year also the virtual speaker series, and after 2 days, we'll have the second one indeed on a rare tumor, which is mesothelioma. And this is both teams from both sides used to present the update. And probably this is good for both of us and also for the junior staff. We also working on the joint workshop, and we had a workshop here 2 years ago, which helped us at King Hussein Cancer Center to start some new technique. Now, provide helping us in capacity building, whether it's a fellowship, 1 or 2 years, or the short training. Indeed, the Princess Margaret staff helping other nations indirectly, because now in Jordan, we are becoming a hub for education training in the region and beyond the region. Indeed, we signed so many collaborative agreements with different cancer associations and cancer centers in the region, like from Palestine, from Iraq, from Libya, and even from Afghanistan and Ukraine. And the latest, actually last week, we signed in Kiev a collaborative agreement where we provide capacity building and helping their staff in training and education. So whatever the gain we really had from this fruitful collaboration, we are transferring this knowledge to other nations and to other societies. And I think that all of us should be proud of. And we are looking forward to expand this successful collaboration in the future, mainly in clinical trials, and also holding a joint conference, which we planned actually before COVID-19. And now this has been postponed for probably a few months from today. Yes.
Thank you so much, Jamal. And thanks for touching on some of the initiatives that we've launched. I think we've been able to take advantage of our transition to virtual to actually continue with each of your cancer centers, a number of ongoing collaborations. You mentioned our tumor boards and our virtual speaker series as well. I think each of your comments have really highlighted how this new philosophy around the importance of international partnership, how we approach partnership, both how it's important to partner with each other and also within our own regions. Mike, perhaps I can ask you as well. You've worked with fellows from all over the world, and you maintain active collaborations with many of them. I wonder if you can talk a little bit about how you felt international collaboration has been important to Princess Margaret.
Thanks, Danielle, and thanks for inviting me today. So, I mean, I think there's many opportunities here that can benefit us at Princess Margaret, and also help transfer knowledge back to other areas. And this has to be a bilateral flow. Some of the best relationships I've had with fellows over the past many years have been fellows who have come from other parts of the world they come here with the hope of gaining experience about how to apply, for example, advanced treatment techniques that they can then take back to their home countries and apply those to their patient populations. But they bring unique perspectives to us that we don't otherwise maybe recognize. And it helps us in terms of how we approach our patients, how we address, for example, some of the disparities in cancer care that still exist in Ontario and Canada, geographically and for other reasons. We can learn a lot by actually understanding what's happening abroad and how those challenges are being approached. I spend a lot of my time treating gynecological cancers, as you heard, cervical cancer in particular, which is one example of a cancer that in Canada, fortunately, is not as common as it once was. But in other parts of the world, it's a very common cancer. In Kenya, for example, where I spend a lot of time, it's the #1 cancer in the country. And so we have a number of collaborations, for example, with the people in Kenya, where we actually bring both surgical oncologists to Toronto on a rotating basis to learn advanced surgical skills to help with the management of those patients. They also learn a little bit about radiation. And we've also spent a lot of time over the past few years helping areas of Kenya build capacity in radiation treatment so that they can actually treat these patients better. It's important to recognize, I think, that most women with cervical cancer in that part of the world and other parts of the world present with advanced disease that's not surgical. They can't be operated on and cured with surgery, but they can be potentially cured with radiation treatment. So it's a very exciting area to work in right now that I think benefits us here in Toronto in many ways. I think also, I hope, benefits other parts of the world.
Thanks very much, Mike. And actually, one of your current fellows, Dr. Abba Scott, was on one of our earlier webinars as well. Mary, you've really been a champion for international collaboration for a very long time, and really built the spirit of global collaboration into the culture at Princess Margaret. Can you comment a little bit about why it was so important to you and how you think this is going to advance cancer care?
Thank you. Well, there's a perception that Canada's a high-income country. We're a very good cancer center. We have everything. And yet I remember going to Tata, 15 years ago, and where we had great excuses why we didn't have PET scanner and we didn't do PET scans because, well, we knew how to treat without it. And you go to Tata and you see there is a cyclotron, there's a active PET program, and you have an impression that you have everything and other people don't. And you go to countries who may have challenges in getting funding and yet push the envelope, do first-class research, have first-class academic programs that are actually better than yours. It's a great motivation to come back and say, hey, we need to move forward. We need to catch up. You go to King Hussein Cancer Center and you have certain perception, it's busy. And then you find out that the clinicians who have fewer resources than we have do much more with those resources. And they push the envelope very hard. They train people. They're very ambitious. They're, in fact, probably sometimes more ambitious than some of our colleagues. And don't we always say we don't have enough resources, we don't have enough this, we complain, we're stressed, we're busy. You go somewhere else and you find people who are much busier than you are, really pushing the envelope, really striving for the best. So I think there is a benefit both ways. And I remember visiting first time AC Camargo and learning that they had a Ludwig Basic Research Institute. And, there are no Ludwig Institutes right now, but there were about 20 years ago. And actually Toronto had one. And I think there were only few around the world. And a very fruitful Basic Research Institute was at AC Camargo that gave rise to first-class research. And to a certain extent, we still have basic research collaboration with AC Camargo, which if you didn't ask the question, you wouldn't even know about it. And I think scaling up this collaboration and learning from each other can push our institution and our organization to be more ambitious, to create the sense of urgency, not to wait for things, but to push the envelope. So I think that in addition to exchanging fellows and creating new knowledge and collaborating, just seeing how people address their problem is very beneficial. I don't know whether Pramesh may want to talk about the India's cancer center grid. Maybe you can say why you did it, but because it's absolutely brilliant idea.
Thanks so much, Mary. And Pramesh, maybe it would be great if you could comment a little bit. You have this enormous network, I think of over 170 cancer centers across India. If you could tell us a little bit about it.
Thanks, Daniel and Mary. Yes, so something similar to what Mary experienced when she visited all these centers happened to us when we visited some of the centers within India. And if you look at the challenges that countries like India face, we are faced with up to a doubling of cancer rates in something like 20 years, and practically not enough resources to manage that. And you very quickly realize that the only hope that you have for actually making an impact and genuinely saving lives is to collaborate. I mean, we could go on and on about how Princess Margaret is the best cancer center in Canada, about Tata Memorial being the best cancer center in India, AC Camargo in Brazil, and the King Hussein in Jordan. But we have limited scale to be able to work within our own institutions. The single important thing that I realized by the formation of the National Cancer Grid was that it's a much better bang for the buck if you are able to collaborate with others, trying to have uniform standards of care across the different countries. So the solution that was provided to us by the Government of India, and this involved a huge amount of funding, was why don't you set up more Tata Memorial centers in other parts of the country? And we said, sure, we'll do that. But if you really want our advice, we'll do that, and also create the National Cancer Grid, which is this huge network of cancer centers. And Daniel, you are right about it being one of the largest cancer networks in India. It is actually the largest cancer network in the world. So what we have currently is, it's not 170, it's grown up to 250 cancer centers over the last decade. And between these 250 cancer centers, we treat close to 700,000 new patients with cancer annually. So rather than look at these small silos where we are able to treat our own patients within our own cancer centers in isolation, I think the global strategy, the strategy of any, as Mary put it very elegantly, self-respecting cancer center in the world has to be to collaborate. You just can't be content treating patients in your own center of excellence and expect that this would scale up. The only hope you have to scale up is to collaborate. The only hope you have is to get centers which are with varying degrees of efficiency, of capability, up to the same level, and automatically your scope and scale gets exponentially scaled up. The example which Mary gave of clinical trials being done much quicker in when you do it multicentric, and I think we've all suffered from these egos where we felt that as a single cancer center, we could do all the research that was needed. As a cancer center of excellence, we could offer care to the most complicated cancer centers. I think we're living in a fool's paradise if we think or believe that. And one of the main reasons why our partnership with Princess Margaret has been so fruitful has been that it's been an equitable partnership. We've sent some of our trainees to Princess Margaret to get trained. And as Mary said, many of them have come back and set out to be leaders in their own right. Princess Margaret has sent some of their top faculty to workshops in India. The Credo workshop that we run on training in clinical research methods is one of the best in the world. And it's in no small measure due to the fact that we've had faculty from Princess Margaret, Ian Tannock, several others from Princess Margaret having been faculty here that has contributed to this. So it's so elementary. If I could step the clock back 12 years when we thought of the National Cancer Grid, I kick myself for having not thought about it earlier. And to any of you who are not convinced about the benefit of collaboration, I would welcome you to see the very tangible benefits, the very practical, very in the world, real world scenario benefits that we've heard from these collaborations. So I'm a huge fan of collaborations and very thankful to the entire Global Oncology Network for that.
Thanks so much, Pramesh. I think you've made a really important point around challenges of an individual institution scaling up alone and how these kinds of networks allow us to achieve much better results. Jamal, you've also have a large network in your own region in the Middle East where you've set standards around access and quality, and you've gained as well international accreditation standards. I wonder if you could talk a little bit about that and how you've worked with other centers in your region to raise the bar on quality. And just if you can unmute as well.
Indeed, now, as I mentioned, we are becoming the hub for education and training in the region and beyond the region as well. Beside that, in our journey for the last 17 years, we really succeeded with international collaboration as well. And one of these international collaborators was Princess Margaret Hospital, that we are really proud to have a fruitful collaboration at many levels. We also linked with the other renowned cancer centers international. So I think this is the best way that how we can really link with others, and also we can help others in the region as well, where now we have so many collaborative agreement with many cancer centers, the new actually cancer centers, especially in Iraq, in Ukraine, in Afghanistan, in Libya, in Palestine as well. So we are providing them not only for in the field of capacity building, training of their staff, and some of them, they have completed their training here, and now they are leading some programs and some departments in their institutions, but also in other areas like the equality, which is really very important. They're trying to have the international accreditation. And since we were the first one to have the JCI in Jordan accreditation and the first JCI specific oncology certificate, as we were the first one outside US to have it in the world for oncology service. Besides, now we are helping others in the field of excellence in nursing care. As you know, that we got 2 years ago, the Magnet, which is really the highly renowned accreditation. And we are, again, as a cancer center, the first one outside US to have it in the world. So we are helping others in the region in different fields, including training, education, capacity building, short or long training, the quality, nursing care, beside other areas as well.
Thanks, Jamal. And, we were actually fortunate to learn about the incredible work that your nursing team has done with the Magnet accreditation in one of our first speaker series that we had between our first two institutions, which has led to a lot of ongoing discussion and collaboration.
Great.
Victor, if I can ask you as well, you think you've really been a leader in something that we all are aiming for around patient-centered care and balancing the clinical demands with research excellence. And I wonder if you could talk a little bit about how you've been working to achieve this at AC Camargo.
Well, thank you, Danielle. Well, in fact, our cancer center started 68 years ago, and we started with patient care, research, and education. So research has always been part of our efforts. And we run from basic research, lab research, translational research, and clinical research. And research is everywhere here at AC Camargo. And I think we can, we use the daily basis questions that come from patient care to generate our projects. We are not rich enough to do everything we want, so we focus our efforts on solving the problems that come from the patient side. And we have basic researchers participating on tumor boards, and they come to learn from clinicians what are the unsolved questions that we need to focus our effort. And we put together the projects that will answer those questions, covering the basics science side to the clinician side. And collaborations has always been in our way of doing things here, either national or international collaborations. And I truly believe that we can do more projects, we can do bigger projects, stronger projects, and faster, as Mary said in the beginning. So we are very open here. I think Brazil can collaborate a lot with the whole community. In terms of genomics, let's say everybody knows that different races in the world have different cancer types and different biological behavior. Well, Brazil received a massive immigration after the First World War and Second World War. We have a genetic variation that is difficult to find in other countries in the world. Every study we do here on genomics is solving questions that will help other countries that are now receiving their immigrations. So we believe Brazil has a genetic information that's valuable to the whole world, as our immigration happened 100 years ago. And we are very open to collaborate with that, and we frequently receive partners that want to be with us to study the genomics on genetic variations on cancer. And because we treat thousands of new cases per year, and we have a huge biobank with over 100,000 samples stored in our biobank, I think we have a rich resources here to answer some of the most important questions in the world.
Great. Thanks so much, Victor. I think I really liked your comment around how you have some of the basic scientists actually sitting in on your tumor boards, and how to really motivate some of those scientists to engage in questions that come from challenging patient cases very directly. Mike, maybe I can ask you, where do you see, we've talked a lot today around some of the very fruitful collaborations that have been ongoing between each other and ones that each of us have been involved in. What do you see as areas for growth or opportunity in collaboration? Where do you still see a need?
So thanks. I think we've heard a bit about this already. I think from a collaborative perspective, most of it at this point, although there's been some research collaborations, but a lot of it has been at the clinical front, right? In terms of how we strengthen that kind of thing. We've had a lot of conversations around the opportunities for research collaborations and how we can, and the opportunities, how we can strengthen those. And we've just heard from Victor some important, things that they're doing there around genomics and that sort of thing. But, I think there is still opportunity to think about within the global community where the strengths are in terms of very specific aspects of cancer biology, for example, or research in surgery or research in radiation treatment, that are pushing the boundaries and pushing us into new space overall, and how we can learn from each other and bring those together. So most of our trainees who have come to Princess Margaret are clinical trainees. We have not seen a lot so far of basic researchers coming. There has been some from different parts of the world, but we have not seen a lot of exchange of basic scientists or clinical translational researchers as of yet. I think there's an opportunity to expand that and have people go both ways. It would be nice to be able to send some of our trainees, both clinical and research, to other other areas as well to acquire specific skills or knowledge or an understanding based on what's happening locally in those other parts of the world. I think that benefits us overall. It's an area that I think we need to work on and grow over time. So this kind of bilateral exchange of trainees is a good way to strengthen those things, but also large bilateral collaborations capitalizing on resources, large genomic databases or large clinical populations that we may not have in Toronto, but may be available elsewhere.
Thanks so much, Mike. I think it's an important point around strengthening research collaboration. And for those who are listening, who were able to tune into our last webinar, we were able to feature recipients of our research seed grants, actually one between Monica Kurzanowska, who's a scientist at Princess Margaret, with Rachel Reichelman from AC Camargo. And we featured our DKFZ clinician scientist exchange with Germany. And I think being able to expand those opportunities even more would be a really great direction to move in.
Can I just add one thing, Danielle, and that's around funding. I mean, you reminded me of that. So, what really is needed as well is large international funding opportunities, or, ways that we can support these kinds of activities on a large scale. I mean, a lot of what we have in Canada that's available to us are basically kind of limited to what's going on in Canada alone, not entirely, but to some extent. And what is needed are these collaborative opportunities where we can get enough resource to do these large scale genomic studies, for example, that cross jurisdictions sort of thing. And I think that is an opportunity to work on for the future as well.
That's great.
Can I come in here for a minute?
Yes, please, Pramesh.
Yeah. So I think that what Mike brought on here is an extremely important point. You could have the best intentions, but without the right funding, these ideas fall flat. So about 5 years back, we went on a collaboration, not with Princess Margaret, unfortunately, but with the Medical Research Council in the UK. And we embarked on this very large, very pragmatic clinical trial, which to this date is the largest trial ever in the world on this question. And the simple question that we asked was, would adjuvant aspirin improve survival after common cancers after radical treatment for esophagogastric, breast, colorectal, and prostate? And the initial funding application went to the Cancer Research UK, which is, as many of you know, the largest funder for cancer research worldwide. And their immediate reaction was, why should we fund something which is outside the UK? And I'm so glad that some members of the board prevailed upon them and decided that it needed to be funded, even though it was funding outside the UK. And 3 of the top 5 centers which are accruing onto the AD-aspirin trial in the UK, and it's a collaborative trial between the UK and India, and more recently with Ireland, 3 of the top 5 centers are from India. So if someone did not have that, the foresight to imagine that an international collaboration, especially with a low middle income country, would bear fruits like this, we would be so much behind in our cancer research. And it's something that's so practical a question and something that's so implementable. I'm so happy that the board members prevailed upon them to fund this.
Pramesh, I'm so glad you brought that up. I think that is certainly something we are aspiring to. We started our seed grants because of this lack of opportunity for international collaborative research. And this is really something that we want to be able to grow, to be able to conduct multinational trials the way you're describing. Jamal or Victor, Mary, please feel free to jump in if areas for growth or opportunities in collaboration.
I'd just like to say a few words about the importance of Princess Margaret Cancer Foundation, because that's always forgotten. And I said that over the years, the only reason why we can aspire to be one of the best cancer centers in the world is because we have philanthropic support. The Minister of Health doesn't fund research. Research funders everywhere in the world are short. And it's through support of our donors that we can start new programs and new partnerships. Many of the fellowships are supported by funding from foundation. And we've heard from the others that everybody else has a foundation And most of the cancer centers that I visited around the world benefit from philanthropy and philanthropic support. So I think we need to acknowledge the very important role of this support.
Thanks so much, Mary, and certainly
Daniel, I want to jump in here as well. We all talked about clinical trials and how important they are to advance oncology. There are some types of clinical trials that the industry will not fund, and we need to find alternatives. Those are the clinical trials for de-escalating the treatments. The industry is very interested in escalating treatments and bringing new drugs, but as in the aspirin trial, we need to also investigate cheaper treatments or treatments with older drugs that can be even better than those we are using today. Some of the new treatments are very expensive, but some countries in the world cannot afford it. So the financial toxicity bring us to study alternatives or plan B protocols that can be used around the world in low-income countries. And sometimes even rich countries can benefit from clinical trials that will de-escalate treatment. And those are never be funded by the industry. We need to find alternative ways. I believe that big cancer centers in the world are in charge of seeking for effective and cheaper treatments, and we can do it together.
Thanks so much, Victor. I think those are really important comments. Jamal, can I turn it over?
Yeah, sure.
to you?
Yeah, Daniel. Actually, yeah, in the future, we are planning to expand our this very important, fruitful collaboration with Princess Margaret in the field of cancer research, and I think this is important for both of us. And I hope that both of us can secure the funding to run these clinical trials and to be part of it.
Thanks so much, Jamal. You know, I think Mary commented earlier in her remarks about how during COVID, we saw how when there was commitment and international collaboration, we were able to, for example, get a vaccine to market in record time. And you know, how I think we've talked a little bit today around how, for example, some of these trials and opportunities for collaboration can address cancer as a global health challenge. Perhaps I can, Mary, turn it a little bit back to you and build on those comments. Where do you think collaboration is going to accelerate efforts to really conquer cancer? Where do you see as some of the most important areas moving forward for our collaboration?
Cancer is, you know, everybody thinks of cancer as one disease, but it's actually the group of most complicated diseases that exist. And it's the complexity of cancer has been recognized. And, you know, one of our colleagues who we know from UK, Richard Sullivan, has been heard to say that if you solve the problem of cancer, you've solved 80% of the whole healthcare, because cancer patients use all the healthcare services, maybe other than trauma or obstetrics. So I think we have a challenge of not only creating new knowledge, but also accelerating how fast we apply this knowledge and create effective solutions for patients to sort of make sure that the patients have access to the best interventions faster. And that's done through global collaboration. I think you probably wanted me to talk about creating new knowledge. The Lancet, which is one of the major journals, and most of us have collaborated with the Lancet, has created a new commission on cancer and health systems. And David Jeffrey, who used to be at Princess Margaret, sort of said, you know, if we solve the cancer problem, we can use the cancer as an exercise machine for health systems. You know, when you think about exercise machines, you get more nimble, you get stronger, you get fitter, you know. So if the cancer can be this exercise machine for the health systems, our health systems will be better. And I think that's recognized, especially after COVID, that the health is foundation of the really economic success of the countries. If you don't have health, everything stops right in the tracks. So I think that we have great opportunity to not only make cancer care better, but make the health systems better. And through global collaborations, we can sort of make sure that we move forward faster. You mentioned the numbers. You mentioned the 20 million new cancer cases every year. It's supposed to double in the next 20 years. There are many opportunities. The long-term survival of patients with cancer has more than doubled in the last 40 years. And we have more and more tools and more weapons for cancer, but we need to be able to apply them in an efficient and cost-effective manner. So there's a lot of work to be done. And I'm actually very optimistic that with the global collaboration and everybody pointing in the same direction, we will actually get there.
Well, I think that is a perfect way to end this panel discussion. Mio, before I turn it over to you, I'd really just like to give my real gratitude and thanks to all of these leaders for joining us this morning. We know how busy you are, and we really appreciate you being here today and speaking about your experiences in your own cancer centers, your work with us, and where we can move forward together. So really quite grateful to you all for being here today. Thank you so much. And now I'll turn it over to Mio.
Danielle, thank you so much. And I echo your comments of gratitude. We heard Pramesh talk about a national cancer grid, and for our viewers, you're listening to a top international cancer grid here. And it really is amazing and inspiring, the work that everyone is doing. I'm going to open up the floor to questions from our audience, and I think we've got a couple that have come in. So I'm happy to read these out, and maybe Danielle or Mary, I'll direct them to you so that we can kind of direct traffic. And I'll just start at the top. And the question is, how do you think we can leverage partnerships globally to simultaneously provide better care and accelerate research?
Thanks, Mio. I'm happy to start, and anyone can feel free to jump in. In Jamal's comments, he talked a lot about how we've started to leverage our partnership with King Hussein online to accelerate clinical care. Over the last year, we've now launched a multidisciplinary tumor board where we bring our very challenging cases for discussion with experts from King Hussein. We've been doing this in the lymphoma site group where I work, and it's been incredibly useful to be able to learn from one another's experience. King Hussein has an enormous volume of lymphoma cases, and that's just one example of how we've actually been able to even increase our international engagement over the last year online. I think all of our speakers today have talked about the opportunities for using partnerships to accelerate research. Pramesh gave a very good example, actually, between opportunities with the UK and India to engage in a joint clinical trial. And I think there are real important opportunities there. Mike talked about how we need funding to expand more international translational research, and I think this is an important area to move forward in. And I don't know if any of our other speakers would like to build on that.
So I'd just like to add that we have this kind of a false dichotomy between clinical care and research. I think people who provide clinical care automatically think of better ideas because they see newer problems in the clinic and therefore are able to accelerate research. And the ones who do research well and the ones who look at the bigger questions in cancer research are the ones who are actually able to circle back in and provide better care to the patient. So I think these are closely interlinked, and one cannot do without the other. And I think very key to this entire success is the fact that we need to leverage partnerships and do that not just locally, regionally, but internationally, as the Ad-Aspirin trial example shows.
Right.
Danielle, let me add here. I really think we should find a common challenge that we all carry in our different health systems. and decide which project we're going to run together to solve a common problem. And that could be financial toxicity or just finding new treatments that can be applied in any country, in any resources, limited resources or high income countries. But we should find a common problem to solve together and listen to other countries, other institutions, and find a common challenge that we can face together. I think if we can solve one big problem together, we're going to feel closer and ready for new challenges that will come. I'm sure with the growing cancer burden we're going to have in the next 20 years, we need to be closer. And we need to practice being closer from today.
Yeah, I think that's really important, Victor. I think we are not going to solve any of our problems by trying to think about them on our own. I think building on these conversations on our virtual speaker series is an opportunity to get to know each other, to brainstorm, I think will be really important moving forward.
I know we're nearly at time and we've got a couple of questions. So in the interest of time, we probably won't be able to get to them both. But Victor, you've put a great challenge to us around, is there one thing collaboratively together that we can tackle? Maybe just a quick ask on the external factors. We did talk about the role of philanthropy and its contributions, but are there other external factors that make it easier to accelerate collaboration?
It's Mary. I think that raising expectations. I think any cancer center should be expected to collaborate globally, to collaborate outside their walls. You know, right now, 30 years ago, multidisciplinary care was a concept. Right now, it's an expectation. Every cancer center has multidisciplinary care. Every cancer center has patient-centered care. Raising expectations that global collaboration is a must, and that any self-respected program and cancer center should be engaged globally, I think would accelerate the progress.
Thank you, Mary. That's fantastic. So on that note, maybe I'll just wrap up. International collaboration is not a nice to have, it's a must. And listening to all of you, I summarize it in terms of a real mindset that you have shown for the world and shown for our patients. And it's a mindset of intense collaboration. It's a mindset of equality and true inclusion. And it's a mindset of deep curiosity. And that is bearing incredible fruits for the global cancer control agenda, which I know is just why we're all here today, and so key in terms of everyone's passion. So Pramesh, Victor, Jamel, Mike, Mary, and Danielle, I want to thank you all so much for your time. This actually concludes our three-part webinar on our global cancer program. I want to thank all of our viewers for joining us today. If you want to check out previous webinars, they are available on our Foundation's YouTube channel. And until next time, everyone, stay safe. Thank you very much for your time today.
Thank you.